So the next topic we're going to talk about is contractions and relaxations. So there are two types of contractions. One is known as the Braxton Hicks and one is known as the labor contractions. So in other words, it's a false and a true contraction. So for the false contraction, it usually starts about 4 months into your pregnancy, your 4th month. It's usually painless and irregular. So you will get some sort of cramp or probably like a period cramp, and then it goes off. You will feel it in the abdomen area, and this is also known as the practice contractions. So it's your body testing out some contractions, and it usually doesn't get longer and doesn't get closer and doesn't get stronger. So the Braxton Hicks also does not cause changes to your cervix. So what Braxton Hicks does is that it goes in and contract your abdominal muscles area. It doesn't contract the cervix. So when it starts to contract a little bit, and then it will just go away. And even though if you have it again, you will feel that it's not painful and you are still able to continue on with whatever that you're doing. But as for true labor contraction, you will feel that it's very paralyzing and you cannot go on and continue to wash the dishes and do your things around the house. So when you have the Braxton Hicks contraction, what you need to do is that just calm yourself down. Okay, once the pain goes away, you just grab yourself some water, change your position to ease yourself a bit, and then just rest give it about 30 minutes to an hour. So to make sure that the contraction really goes away. In worst cases is that when Braxton Hicks gets a bit too strong, it can sometimes lead to a early contraction or early labor, which is something that you don't want to. You can also ask your doctor so that the doctor is able to teach you more about the contractions. So for labor contraction or the true contractions, there are 3 stages to this. So first is known as the dilatation phase, and then the birth, and then the placenta. So dilatation phase is, as you know it, you're supposed to wait until your cervix expands to about 10 cm. That is when you're ready to push the baby out. So then you will go into the second stage known as the birth stage, where you start pushing, and this is when your baby is delivered. So after your baby is delivered, then the last one is the placenta stage, where the remaining of the placenta will be delivered out of your body to clear the cervix area. So as for relaxation, I will teach you some simple technique, but we won't go too much in detail, or I will not try to load you with too much information. It's because when you go into labor, and in the labor room, it's too much happening and everyone will be too panicked. So it will be very difficult for you to start calming yourself, do meditation and those kind of things. So what you need to do is just to concentrate on your breathing. So when you have a poor breathing pattern, means you can't breathe properly, you have lesser oxygen, and then that will give you a lower concentration on pushing your baby out. So the main thing and the most important thing you should always focus on is your breathing. Make sure you have enough oxygen, or make sure you have enough air. Okay? So what you need to do is remember this: he, who. Okay? So you can't really breathe in. Okay? You will not be able to do this perfect breathing pattern. So what you need to do is you remember he, who is so that you remember to suck in air and you remember to blow out the air as well. So what you do is during the he, you breathe in, okay? And during the who is when you blow it out. So all you need to do is just go he, who. He, who. Okay? So you don't actually say the words out, but you're actually just doing the action of it. So you go. So as long as you can still breathe in through your nose, try as much as possible to breathe in through your nose. But if you can't, it's fine to breathe in through your mouth. But we try to avoid that because you will start getting a very dry throat and you may start coughing as well. So it may interrupt your pushing of the baby. So what you need to try is just go, okay? But when you can't, you can go, alright? You can try it at home and practice it with your husband. Thank you very much.